Hello, everybody. We were thinking how to put it in the agenda of the conference, this session. We didn't want to sound too alarmist, but on the other hand, this is the sober reality we live in. There are so many conflicts going on in the world. There are some websites where you can check it, and it looks like currently there are more than 100 conflicts, active ones. Some of them are very recent, some of them are going on for more than 50 years. We wanted to take one of them and look at it from different angles, put a magnifying glass to it. We wanted to hear, we took the example of the war in Ukraine, the war on the borders of the EU, and we wanted to have a look from inside the country, what lessons can be learned from it for preparedness. Preparedness is again one of the key words here. And then we wanted to also look at a country that received millions of refugees and provided care for them. So we wanted to have a holistic view of this. We know that Ukraine is under enormous pressure, and the healthcare system there, and not just the healthcare system, but it's also infrastructure. There are power outages which have impact on the vaccines stored, etc. And in the middle of all this, you manage to still reform the system, proceed with digitalization, which is very impressive. We wanted to hear more about that. And we also wanted to hear from Poland. How do you deal with the situation that you have millions of people crossing the border in a very short time? So this is what we will look at during this session.
Thank you, Piotr. And good evening, everybody. Thank you for being here for this session, which I think promises to be very, very important and very, very interesting. Our three speakers are really extraordinary, and we are very privileged to have them with us today. We have Ihor Kuzin at the end, who is currently serving as the Deputy Minister of Health of Ukraine, and he's also the Chief State Sanitary Doctor of Ukraine. And he has a long history of experience in surveillance and field epidemiology and laboratory research, obviously in addition to his political background in the ministry. We have Olga Gvozdetska, who is the Deputy Director General of the Public Health Center of the Ministry of Health of Ukraine. And she has a lot of experience in managing and coordinating health and social programs, and currently is particularly focusing on work on viral hepatitis, opioid dependence, HIV, and TB. And as Piotr said, we also have Katarzyna Drążek-Laskowska from Poland, as the country which is bordering Ukraine, directly next to the border there. And Katarzyna is the director of the Department of International Cooperation of the Ministry of Health in Poland. And in 2022, she was appointed as the plenipotentiary of the Minister of Health for the continuation of treatment abroad for Ukrainian patients who came to Poland. So she's been responsible for setting up a lot of the systems in Poland to oversee continuation of care for people. So these three colleagues are going to be sharing their thoughts and insights with us, and as I say, we are incredibly privileged. As with the other plenary that we had this morning, and as with the other sessions, we do have the opportunity for you to ask questions, and you can do that through the app, as you've done previously. And we also have this mic somewhere over here, so that there are also, if there are people in the room who would like to ask a question, then you're welcome to go to the stand there. Martin will organize for you, and we will take the questions on that basis. If you see a question in the Swapcard site that you think is interesting, please like it, because that will tell us that there's interest in that question in the room, and it may help us to decide upon which questions we will be asking of the colleagues. So please do that. Like the questions that you think are interesting. Before we start, we're going to go to our Slido moment, and we're going to get you a little bit involved here, because we want to have a sense from your perspective about how prepared you think Europe is at the moment. So open up the slide, there you go, and you've got now a bit of time to think about this. Take your time. The question is, are the public health systems in Europe prepared to deal with the consequences of a conflict situation, for example, a large influx of refugees. And if you think the answer in Europe is really not prepared, then you would give it a 1. And then you can grade your response up to 5 if you think that Europe is well prepared. So please take a moment and add in your score. And I can see already there's about 150 people who have scored, so let's keep those numbers coming in. Let's keep the votes coming. Now we're up to 250. It's a lot of people voting. It's exciting. We have lots of people in the room, and we have even more people online watching. So let's just give it a moment more. I give you 3, 2, and 1. Okay, thanks. Let's see what we get. What's the result? Okay. Somewhat prepared. So overall, slightly left skewed. We're not as prepared perhaps as we should be, according to your first impressions. So that gives us a starting point for our discussions. And I'm now going to hand back to Piotr. Please.
Thank you very much. So without much further ado, I would like to invite Ihor now to tell us about how to mobilize, how the Ukrainian public health workforce has been mobilized during the war in Ukraine. Ihor, please, the floor is yours.
Dear colleagues, thank you so much for this opportunity, and it's a great pleasure to be here with you today to discuss the challenges, the success we have experienced during the full-scale invasion. I hope our experience in Ukraine will be useful for other countries to make your own system best prepared for public health threats. Unfortunately, not so many information are available for public discussion due to security reasons, but most of public health decisions I will try to present in this presentation. So a little bit more about our healthcare system in Ukraine. As you can see on the slide, the healthcare system in Ukraine is undergoing a phase of reformation and transformation. And of course, on the national level, we have Ministry of Health of Ukraine for sets policy, and of course for set up different type of standards and procedure. We have national key institution, strategic institution under the Ministry of Health of Ukraine is Public Health Center, and Public Health Center is responsible institution for coordination of all type of public health activities in our country. And of course, it's a key institution for public health preparedness and response. And on the regional level, we have Regional Center for Disease Control and Prevention for epidemiological surveillance, outbreak investigation, vaccination campaign, and many other issues. And of course, laboratory service in the Regional Center for Disease Control and healthcare facilities, different type of hospitals. What is the main function of public health? It's like the similar of for not only for Ukraine, for many countries. It's disease prevention. It's also educating and informing the public. It's also sanitary and hygienic control in the country and conducting epidemiological surveillance for different type of infectious disease and non-communicable disease. On this slide, you can see a typical picture of a destroyed hospital. It's like a very complex damage with, unfortunately, with very long time for restructuring these healthcare facilities in the future. On February 24, 2022, the war broke into every Ukrainian home with mass shelling and missiles across all the country. And today, our healthcare system is facing the unprecedented challenge posed by the full-scale invasion. But all this type of challenge can be characterized by 6 main types. First of all, it's access to health care and medical care on the regional level due to the damage and destruction of healthcare facilities. And of course, in addition to that, we have some lack of medical employees during, especially because some people was moved out the country, and of course we have lack of some type of medical specialty on the regional level. For example, some type of specialist with rehabilitation area or surgery area. The next challenge is population displacement and evacuation. And of course, it's a lot of people, a huge number of internally displaced people in the country. The next one, it's rising number of injuries and illnesses. It's not only physical injuries, but also psychological trauma and another type. And of course, a big risk of bad sanitary and epidemiological condition in different areas. For example, risk of outbreak of infection disease and also problems with water supply, increase and migration of rodent population. So it's also affected to the our risk assessment for outbreak and for our epidemiological wellnesses. Also, it's bioterrorism and nuclear risk. Russian Federation occupation of a Ukrainian nuclear power plant, and also we have very big risk for using chemical weapon. And by the way, this week the OPCW, it's officially released a report on the fact of the use of chemical weapon on the territory of Ukraine. So it's really complicated situation, especially in frontline area. And last one in the slide, it's mental health. Mental health issue among both military and civilian population. And of course, it's cases of PTSD and depression, so it's very comprehensive and very complex problem in Ukraine. I don't want to go into detail about the numbers, but you can see that war destroys hospitals, pharmacies, kills people, and as of today, 2027 healthcare facilities and 75 pharmacies was destroyed, and more than 1,500 hectares facilities damaged. And also, for example, 48 healthcare workers killed. Also, the war has caused pollution of over 5 million hectares of agricultural land in Ukraine. And also, we have significantly change of environmental situation in Ukraine during the bombing and shelling. To address this challenge, we took immediate action. For example, it's some our national act for sanitary situation. For example, a special regulation for blood donor marshrutisation during the country. So it's one of our first decision on the national level. The next one, it's sanitary and epidemiological well-being in temporary settlements in the country, because we have a huge internally displaced people. Also, it's special regulation and special procedure for sanitary and hygienic control during the war situation. And also, we established a temporary sanitary standards for drinking water in wartime, because we have a lack of reagent and, of course, some lack of electricity. So we established a temporary sanitary standards for drinking water. And also, we create 97 rapid response team for biological, chemical, and radiological threats on the regional level. But in the same time, we have a swift, comprehensive solution. It's mobilization of medical resources on the national level, and also with like local hubs on the regional level. It's medicine and equipment supply for uninterrupted supply chain for drugs and medical equipment. And also specific regulation for medical facilities to better treatment to wounded people, for example. And also it's securing medical and humanitarian assistance to the military person. Despite these difficult times and challenge our healthcare system faced, Ukrainian passed the law on public health system in 2023. It's our K-law, which integrate the best European practice for public health. For stability of the public health system during the crisis, several long-term measures were implemented. It's telemedicine for remote consultation. The next one, it's stockpiling for critical medicine on the national level. Like a strategic reserve for medicine and medical equipment to ensure crisis readiness. The next one, it's strengthening the emergency medical service, also including the personal training for rapid response team. The next one, it's digitalization of medical service, because we need to intensify our e-health system on the national level, and also to better conduct telemedicine service also. And the last one, it's training medical workers to operate in crisis condition. It's one example of rapid action during work condition. It's vaccination catch-up campaign for measles vaccination. The best results of this program, it's achieved about 91% of our goal. The next one, it's a rapid response team to the Kakhovka disaster. And of course, it's very complicated situation in this region, and especially I would like to thank you so much, ECDC, for helping us to rapid risk assessment in this complicated situation also. The next example, it's preparing to potential threats from the Russia-occupied nuclear plant, because it's very complex region, it's a complex situation, and we need to better prepare our emergency medical team. And I think it's my last example. It's response to the need of the people in the deoccupied region, because as you can see on the deoccupied region, we have a very complicated environmental situation, and also a big risk for outbreak in the future. And I think it's my last slide. I'd like to thank you so much for all of our partners, government, international organization, to mobilize your effort to especially for humanitarian aid. It's some number, but it's really crucial needs for our country in this complicated situation. Thank you so much.
Thank you very much for this impressive and moving presentation. We will have time for questions later, but I would like to ask you just one question now. I know you'll probably tell us that it's impossible, but how could other countries prepare for something like this? What are the key lessons from what you know now? What would you suggest in terms of preparedness?
Thank you so much for this question. I think that the best recommendation is the next. First, it's establish a comprehensive response or contingency plan in the event of internet restriction. In some frontline area, you can't use internet connection or mobile connection. So we need to contingency plan for healthcare facilities, for public health emergency team, for emergency team without internet connection. The next one, it's implement flexible review mechanism of national requirement, especially for water supply, for water quality, for air quality, because you don't know what's maybe happen in the next months. And in the same time, national regulation must be very flexible. The next recommendation is using simulation exercise in full-scale mode against tabletop exercise, because only in maybe full-scale education you can demonstrate the preparedness and readiness of healthcare system. The next recommendation for me is develop effective blood management system, because blood is essential not for civilian people but also for military people, and of course increase public awareness and public preparedness. The many people don't use any actual information about route of evacuation, about like SOP for people, what's happened and what is the next. And I think it's also important management of chronic diseases is especially about a patient for diabetes or patient with some chronic condition, and also for TB or HIV patients. And I think another block it's preparing for war-specific infection disease. For example, in some place you can't use effective prevention measures. For example, vaccination for pets on the territory of your country, because some problem territory or maybe territory with minus. So some territory with minus. And I think the last one, it's preparing a clear communication strategy, because war, it's not only position war, it's also disinformation. It's also different type of IT attacks on your IT system. So you must prepare a very clear communication strategy with your people, with trusted channel. I think it's the most recommendation that I will have.
Okay, thank you very much. It's really a privilege to hear these concrete recommendations from someone who comes from this situation, and to hear it firsthand from those who are exposed and cope. So let's give Ihor applause. So, John, over to you.
Thank you. Thank you, Ihor, very much. A fantastic overview of the whole, which is, you're facing, obviously, unbelievably enormous problems. What we're going to do now is to focus with Olga on something a bit focused. We're going to talk about continuity of care for people with HIV and TB. So, Olga, the floor is yours. Thank you.
Thank you, John, and Piotr for introduction. Dear colleagues, dear guests, dear friends, it's a big pleasure to be here, and I'm happy to share our success and our actions probably since last 1,000 days. Just a moment, I'll manage this system. Over the decades of the fight against HIV and TB, Ukraine has made considerable progress. As of beginning of 2022, HIV services were provided in alignment with modern international strategies developed by UNAIDS, WHO, CDC, following clinical protocols and healthcare standards rooted in evidence-based medicine. At that time, it appears that everything was on the right track, and we were making steady progress towards the elimination of HIV and TB. With the support of partners and donors, Ukraine has managed to achieve sustainability of HIV services and create a self-sustaining system, so the state budget had been funding the procurement of medicines for many years. HIV services were available in every corner of Ukraine, and 390 RT sites provided services at the beginning of 2022. The number of people tested and initiating RT therapy increased by leaps and bounds, reaching the great results of the global cascade 95, 95, 95. 75% of HIV-infected people knew about their status, 83 of them received treatment, and 94 of these people had reduced viral load as at the beginning of the 2022. In addition, Ukraine has made impressive progress in PrEP, in PMTCT, and destigmatization of people living with HIV and the disease itself. Since 2019, HIV prevention services for the representatives of key HIV risk populations, MSM, sex workers, people who inject drugs, and services for care and support for people living with HIV have been partially state-funded. In 2021, Ukraine fully switched to state budget funding for HIV prevention and care and support services, allocated $5 million in 2020 and $5.6 million in 2021. The transition to a state budget for some services was an essential demonstration of efforts, coordination at the state level, and a significant result of the country's work. Regarding the TB, Ukraine was and still is one of the highest tuberculosis burden in Europe, but the fourth highest TB incidence rate among 83 countries in the WHO European region. Despite this, Ukraine has made remarkable progress in the fight against tuberculosis over the past several years, as the World Health Organization recognized. Ukraine has successfully implemented a comprehensive approach to TB control, focusing on early detection, effective treatment, and prevention. Between 2015 and 2021, TB incidence rates steadily declined, reflecting improvements in case detection and treatment adherence. We saw a marked increase in treatment success rates, particularly for drug-resistant TB, thanks to the adoption of shorter, more effective treatment regimens supported by WHO guidelines. Digital health tools were introduced to improve patients' management and treatment monitoring, helping ensure that individuals with TB could stay connected to their care providers. But the war has changed everything. The war, Ihor already has mentioned already, the war has affected access to healthcare services and medicines in the country and led to the unprecedented challenges that Ukraine still faces. Millions of people have migrated both within Ukraine and abroad, which has caused an uneven load to the healthcare sphere. Patients' pathways were changed. Links between doctors and healthcare facilities have been lost, and the need to find new points of entry for receiving services has emerged. In addition to the migration of patients, the migrations of doctors has become a critical problem. According to the public health data, about 20% of healthcare workers, professionals, including staff for HIV and TB services, had to relocate within or outside the country. Some of them went to the army. As already mentioned, before the war, the government has covered most of Ukrainian financial needs, including treatment, diagnostics, prevention, and care. The war caused a profound economic downturn and fiscal constraints in government budgets, including healthcare, thus requiring significant donor support. For example, Global Fund, PEPFAR, European Union, to maintain essential HIV and TB services. In the eastern regions close to the front lines, the healthcare system operates under extreme conditions. Constrained shelling poses a dual threat, endangering the lives of both patients and medical personnel. Many healthcare workers have been forced to evacuate for safety, leaving these areas critically understaffed. The remaining personnel worked under immense pressure, offering risks their lives. Infrastructure damage from shelling has severely disrupted patients' routes, making it challenging for individuals to access essential services for HIV, TB prevention and treatment. Many facilities have been destroyed or damaged, cutting off critical care for vulnerable population. In contrast, the central and western regions, while safer, after facing a different set of pressures, with millions of internally displaced people seeking refuge, the healthcare infrastructure in these regions is stretched thin. Hospitals and clinics that were already operating at capacity now faced unprecedented patient load. IDPs often moving between regions in search of stability, creating a challenge for healthcare continuity. Maintain accurate patients' records and ensuring uninterrupted treatment for chronic conditions is a complex task. We had to act quickly in the early days of the war, overcoming fear and chaos to avoid interruptions of HIV and TB treatment. it was decided to allow patients who had moved temporarily to receive treatment at the point of care. What this means that they were actually, got services where they actually staying. To ensure treatment conditions for patients who were created abroad, a clinical management protocol for data exchange between doctors in Ukraine and doctors abroad has been developed in partnership with other partners, including ECDC. In addition, several technical solutions have been created to provide continuous information, such as applications, websites, so forth. So, close and coordinated collaboration with donors, partners, and volunteer organizations, several immediate managerial decisions were implemented to restore the supply chain and ensure continuity of treatment for thousands of patients during the martial law. By the way, there is still no flights to Ukraine. We're using only buses and trains, because last week I had a chance to a very strange question. You are not flying? No, we are not flying. Only military flights occurred in Ukraine. That means that we should very quickly restore and restart new routes for delivery of the drugs. As you can see on the slide, the war significantly impacted pre-war indicators, slowing down the progress of the HIV response. However, despite all the challenges, we continue to increase our efforts to overcome HIV. Thus, despite a decrease in 2022, testing services continue to grow rapidly. Thanks to the active aim at returning lost patients and several management decisions, the number of patients receiving HIV treatment has been maintained. Active efforts are being made to communicate with patients who have not attended healthcare facilities on time, so that they can re-engage in care. Despite the state budget deficit, NGOs still continue to provide HIV prevention services for key populations and care and support services for people who live with HIV. Thanks to the cooperation of all major beneficiaries and the Global Fund with the active participation of the Public Health Center. Despite the ongoing challenges, tuberculosis continues to be treated effectively in Ukraine in alignment with WHO recommendations. Our healthcare system has ensured access to the latest evidence-based treatment regimens, even amidst the disruption caused by the war. 76% the effectiveness of treatment of sensitive TB cases has remained virtually unchanged in recent years. 63% of the treatment effectiveness of MDR TB cases also remain stable. The PIPAL-M regimens and new standardized treatment for drug-resistant tuberculosis had been a significant advancement in TB care in Ukraine. We have approved strategically important documents, provided access to modern treatments, and witnessed the heroism of healthcare professionals and volunteers. These achievements reflect the resilience of the Ukrainian people and the unwavering support of international donors and partners. Recent adoption of TB law, effective February 24, marks a significant milestone. We have established standards of healthcare for TB, aligned with WHO recommendations, and we are leading in the introduction of innovative therapies through operation studies of new short regimens, including PIPAL-M regimens. For the first time, we are financing TB social services through state funds, supported by a comprehensive package of regulatory documents. Also, in 2023, amendments were made to the HIV law. The operational plan for 24-26 for the implementation of the state strategy for combating HIV, tuberculosis, and hepatitis for the period up to 30 was approved, taking into account all current challenges. We have often discussed the immense challenges that war has imposed on Ukrainian healthcare system. While we cannot control the relentless shelling and the dangers posed by Russia, our perspective has shifted, as we are in a third year of this conflict, of this war. We now view these challenges as the conditions under which we must fulfill our mission, rather than insurmountable obstacles. Despite the adversity, many of these challenges have been addressed through resilience, innovations, and collective efforts. However, it's impossible now to wonder what could we have achieved if we have been able to dedicate 1,000% of our focus and resources to advancing healthcare rather than constantly adapting to war disruptions. These questions remind us of the incredible potential that exists within our system, even under pressure, and it drives us to keep pushing for progress, no matter the circumstances. For over a decade, Ukraine has faced the harsh realities of war, with the past 1,000 days marked by the full-scale Russian invasion that have deeply affected every facet of our society. However, in these challenging circumstances, we have not only learned from our own mistakes, but also strengthened our resolve and confidence in our system's ability to withstand and adapt to emergencies. In such a volatile environment, preparation is never truly complete. It's a continuous cycle of development, testing, and improvement. No matter how robust a system appears, there is always room to strengthen, adapt, and to new threats, and ensure it meets the evolving needs of people it serves. This progress would have been not possible without the invaluable support of partners, NGOs, civil society, and international donors who provide us with essential support, equipment, and supplies, and we are incredibly grateful for that. But we continue to fight, and please remember that our fight extends beyond Ukrainian borders. We are defending the fundamental rights of all humanity. We stand for democracy, human rights, and the rule of law. Slava Ukraini!
Героям слава.
Thank you very much, Olga. Beautifully put. Many things come to my mind, as with everybody. I think there are three words that really summarize to me what you've just talked about. It's innovation, it's solidarity, and it's resilience. And I think it's remarkable what you have demonstrated there, so thank you so much for that. I have a question for you, which in some ways is similar to the one Piotr asked Ihor. With all this, and given the fact that you have had to adapt, as it were, to a moving target, what would you say would be the lessons you have learned that could apply to a European context to prepare for something like this? What would you say to a European Ministry of Health or Institute of Public Health or leaders to advise them to prepare for ensuring continuity of care for TB and HIV patients?
Thank you, John, for the question. Actually, I put some recommendations in my presentations, but I will happily repeat. Definitely, the most important is people and staff, medical staff. Please invest in people and medical staff. Prepare them, train them. Ihor told already about simultaneous simulation exercises. So people should be trained and really prepared. The next one, the centralization of services, what we faced. As much services as that is decentralized, it's better to provide them in critical conditions. The third one, probably I would like to highlight primary health care. Last year, all our primary health care providers were trained for provide mental health first support. So primary health care should be trained, prepared, and be ready to provide services. Develop plans for rapid mobilization of medical staff, because people moved from region to region. Some of them go to the army, so you should fulfill this niche or gap of the healthcare providers. IDP support, please consider always plan B. What you will do if you will have twice clients, twice patients, 3 times more patients, how you will manage. Probably task shifting, involving volunteers, something like that. Pathways, definitely develop supply chains, because in one day, then sky can be closed and you should have alternative ways of supply chains. Probably it's the most important, mobile clinics, probably the last one. It's good practice for us that mobile clinics can bring the service to the hard-to-reach districts or parts of Ukraine, and to the people that can't go to the center, to the healthcare facility by themselves. Probably
That's a good list. That helps us a lot. Thank you, Olga, very much indeed. We'll come back to you with more questions later. I've already seen some questions coming into the chat, so thank you very much for keeping those coming. And don't forget to like the ones that you think are most important, so we can really highlight the key questions for you. I hand back now to Piotr.
So now I would like to invite Katarzyna to tell us how Poland reacted to this unprecedented situation with millions of refugees coming to the country and the need to provide help and care for them. Katarzyna, please.
Thank you very much, ECDC colleagues. I think that this is really, really important that we are able to be here together today, because as you already answered, only 36% of all of us thinks that we are somehow prepared for the next health crisis. And still, 22% think that we are not prepared at all. So that's why I think that this kind of meetings, this kind of opportunities, when we can share our experience, when we can do some lessons learned, are very, very useful for all of us. I would like to share with you some information about Polish response to the illegal Russian war and influx of Ukrainian migrants to Poland. It is very hard to say this briefly, so I will try to keep my time. I will try. But I would like to start with some introduction, some general information which are really, really important for all the story. Here you can see some photos from the border. People who are fleeing to another country, who are very afraid, who are scared, who are not prepared for the situation, mothers with kids, and in a very, very hard time for them, because no one of us was prepared for this situation, for the war. I think that we cannot be prepared for the war. All we have to do is not to allow any wars, I think, because we cannot be prepared. You can see at those photos, you can see some actions taken by the Polish administration at all, because not only the healthcare system was responsive for the situation. All of Polish administration tried to support each group of people, patients and people who are not patients, but we tried. We tried, and you can see the information about the influx of Ukrainian citizens coming to Poland. Here you can see when the first million of people came to Poland, crossed the Polish-Ukrainian border. It was the 22nd day of war. Today, till the end of October, we know that 24 million of Ukrainian citizens crossed the Polish-Ukrainian border because of the war. Each of this person was offered full healthcare services on the same basis as the Polish citizens. I think that it is really hard to be prepared for this kind of influx of people. I know that this is 2.5 years, but here you can see 22nd day of war and influx of 1 million people. So, what we try to do, how we try to answer for this, to this situation. We provided changes in the Polish legislation. So, every citizen of Ukraine who stay on the territory of Republic of Poland was offered, and it is still entitled, to medical care provided on the territory of Republic of Poland, with healthcare services on the terms and to the extent that persons covered by compulsory or voluntary health insurance are entitled to. It was possible thanks to Act of 12th of March 2022 on assistance to citizens of Ukraine in the context of the armed conflict in Ukraine. This act was our response not only in the field of healthcare, but for all of Polish administration, we were allowed to provide some activities and some solutions dedicated specially for this critical situation. Here you can see some healthcare services proposed to Ukrainian refugees under this specially created act. Vaccination for children, possibility of continuing anti-tuberculosis and anti-HIV and AIDS treatment initiated in Ukraine. And you can believe me that it wasn't easy to organize this, because in Poland, as in other parts of EU, we have harmonized system of registration of drugs. And some of drugs used in Ukraine were not registered in Europe. And it was really, really hard to organize this kind of support with access to the drugs which were used in Ukraine. But we weren't alone. With the support of international partners, especially WHO, we were able to organize also this kind of support for Ukrainian patients. Also, we provided simplified procedures for Ukrainian medical professionals to obtain the right to practice in Poland. It was very, very useful for Ukrainian patients. Still, the Ukrainian personnel is allowed to practice in Poland. I think that it is really important in the field of mental health and mental support, because we have Ukrainian speaking personnel who's ready to support Ukrainians in their mother language. So this is, from my point of view, this is really useful for patients. We created also special IT solutions like application Leak RPL, which allowed to communicate patients and doctors and medical professionals with patients. We organized also teleplatform and hotline for Ukrainian patients, for example, to support health literacy, I could say, because this hotline was very useful when patient needed help. We were ready to say, okay, you need to do this or this or this. You can find doctor here or here. You need to call, you need to register. Each patient was informed about the system, about next steps, and was informed how to reach the doctor or other medical professionals. We also organize help for the wounded and the war victims, which was also not so obvious for, I think, not only for Polish medical system, but for the medical system in Europe, that we forgot that we need also this kind of medicine for soldiers. And this is our new reality, unfortunately, that we need to remember about this. Few words about vaccination assistance. You can see some numbers. I think that they are actually quite impressive. We propose for the Ukrainian refugees free vaccination against COVID-19. Also, you can see information about selected drugs against HIV and AIDS and TB for Ukrainians staying in Poland, as well as the support of medical equipment. Here you can find also some numbers, and I think that this is a really nice example of international solidarity, I could say. Because you know that Poland is not a country who is able to respond for all of these challenges. We need support. We need international solidarity. We need other partners to support us in providing help. And here you can see example, one of many. Memorandum of Understanding with UNICEF, which was used to organize information campaign promoting vaccinations for children coming to Poland from Ukraine. Also vaccine donation support, especially, which was important, polio vaccine, hepatitis A. Also, access, it was some kind of support of ensuring access to basic healthcare services for mothers and children. I think that this is something good to share, that with support we are ready to organize really, really practical support for patients. Some information about preventive vaccination program. It is mandatory for Ukrainian children who stays in Poland for more than 3 months. And it applies to children who were not vaccinated in Ukraine or whose parents do not have the documentation of previous vaccination, and should start this vaccination in Poland as soon as possible. Children are also provided with an assessment of their health and preparation of an individual vaccination schedule by a doctor. Vaccinations after birth are performed in the hospital. The child's mother receives the child's health booklet with records of the vaccination performed. Subsequent vaccinations will be performed at the primary care clinic where the child will be treated and examined. And this is the same solution as we have for Polish citizens, for Polish children. In primary healthcare, the doctor should enter information about all vaccinations in the electronic vaccination card, and the vaccinations will be visible in the patient's individual account, which is also available on the same basis as it is for Polish citizens. Here you can see some differences between the Polish and the Ukrainian vaccination schedules for children. Polish calendar differs slightly from the Ukrainian calendar. First of all, in the number of vaccine doses and the schedule of their administration. So you can see that it was also a challenge for Polish healthcare system to adapt patients, especially this youngest one, to the Polish regulation related to the obligatory, to the mandatory vaccination. You can see that children born in Poland, children born in Poland, I think that those are also impressive numbers, because newborns born to Ukrainian mothers, more than 6,000 kids. Number of hepatitis B vaccinations, more than 6,000, and it is 95%. Number of TB vaccination, more than 6,000. I think that this is really, really impressive. Some example of information prepared for Ukrainian patients. They are available at the vaccination portal in Poland, at the governmental website, everything in Ukrainian language. And this is the part related directly to the field of public health. But I would like to share with you something which I think that is really important to share, that we are able to do this kind of support, that we are able to create something totally new. And I am really proud of it, that we were able in Poland, with international support, with European Commission support, with WHO support, to create really, really special place, Medevac Hub Jasionka. This is a place which supports Ukrainian patients traveling from Ukraine for the treatment in European Union countries. I think that this is a really important solution, because it was created especially for this situation, for the situation of Ministry of Health of Ukraine, which was responsible for organizing the treatment for each patient in Ukraine, especially those patients with long-term diseases. And they did it. With our support, we create the system within EU countries, within all of Europe, and we are able to support patients for more than 2.5 years, and we will do it for next months. Here you can find some very detailed information that this Medevac Hub Jasionka is created with EU civil protection mechanisms, with using mechanisms which were already within EU countries, but we adapt them to the needs of Ukrainian patients. Polish Center of International Aid and a WHO-certified emergency medical team type 1 has been appointed by the WHO on the request of Polish Ministry of Health to operate the Medevac Hub Jasionka. How Medevac Hub Jasionka is organized? 40 inpatient rooms with basic medical equipment, 24/7 medical assistant and monitoring, experienced medical staff on 24-hour shifts, space for accompanying persons, including child-friendly space. This is really important. Referral hospital appointed in case of patient's condition deterioration, and evacuations. Medevac hub Jasionka, first of all, increases the safety of relocated people by providing accommodation, but first of all, the healthcare and mental health support. Ukrainian doctors are working in the Medevac hub Jasionka, and sometimes these medical professionals are the first people who are speaking with Ukrainian patients who are coming to the treatment in other EU countries. I think that this is something really, really important, that we have to inform people what is happening, what is the next step for them, what will be the next day where they are going, and what is happening with their family members, with the accompanying persons. This is really, really important that this medical personnel is ready to share all of this information with patients. Here you can see that Medevac hub Jasionka providing some basic observation, nursing care and psychosocial support for relocated patients and ensuring continuity and modification of current medical care. This is really important, but I am really proud of those numbers, who you can see that by November 14th, more than 2,600 persons were transferred via Medevac hub Jasionka. I think that that's impressive. We are ready to continue this kind of support, of course, with support of other countries, with EU support and WHO support. Poland is first to help. Thank you very much.
Thank you very much, Katarzyna. People probably noticed that my colleagues started practicing the pronunciation of Polish names. It's also a preparedness measure before Eskaida in Warsaw next year. Katarzyna, you have obviously an enormous experience because you've been in charge of organizing the provision of care to Ukrainian refugees since the beginning of the war. I remember when we had missions from ECDC to Warsaw, I was there on the first mission. We had calls at 10 p.m. on Sunday about medical evacuations, etc. And you've been doing this for all these years. So with all this experience, what are the few key things to the other countries? Of course, the other countries also are involved in this, but Poland has been so much exposed being the neighboring country. What are the key messages to the others, how to prepare for this better? You said it's impossible, but you probably have some key points there.
I tried to briefly organize my answer for this question, but it is impossible to do that. But I tried. I did my best. So I wrote down some sentences. First of all, put yourself in the shoes of the person you are helping. Imagine all of the circumstances she or he is in. I think that this is the most important part, that we have to think from the perspective of patient, from the perspective of person we would like to support. The second sentence, really important for me, diagnose your available resources. If you have any shortages, ask others for support. Ask international community, specialized international organizations, ask NGOs. For me, this is the biggest lesson learned, that we cannot act only by ourselves. We need international solidarity, and I think that example of Ukrainian crisis is really beautiful example of international solidarity, not only within EU countries, but all over the globe. And the last sentence, but definitely not least, remember that you help people who are afraid, who have lost stability, who do not know their nearest future. So what does it mean for me? Be human. Be human to human. You act for real people, not for the imaginary problems. So I tried my best.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
So we have received a lot of really interesting questions, not surprisingly, and they will. I'm going to ask. We have time for just probably 3 or so, maybe 4 if we're lucky, but I think they'll complement what has been said already very nicely. And the most liked question, which I think is a really important one, comes from Giri Shankar. The question is for Ihor and Olga. During these really testing and difficult times, what strategies and interventions have been used to keep and boost the morale of healthcare workers, and what communication strategies have helped to keep the trust of the population in the government high? So it's 2 parts. How have you worked to keep trust high, and how have you supported the mental health needs of healthcare workers?
For communication, we have national communication line or strategy. It's like national telemarathon and special type of government information. And of course, it's really useful experience because with common source of evidence information, we can share this information between all regions of our country. But in the same time, in small village or small areas, we use paper form of information material. It's really important because they don't have adequate access to the internet, and sometimes some troubles with mobile connection. It's about communication. About the next questions, it's I think on
Morale, health, mental health, yeah, for healthcare workers.
Mental health, I think it's 2 parts, because first of all, it's mental health among healthcare workers, and of course the big problem it's burnout of medical workers, and we need a special program for support. In Ukraine, we have national hotline for medical workers for burnout prophylactics, and also different type of non-governmental support or initiative for healthcare workers on the front line or near the front line. And for the general public, our main strategy is integration mental health in primary healthcare function, because we have a lot of primary healthcare doctors, and it's really important that mental health must be a part of primary healthcare.
Probably I will add a couple of words. Firstly, I would like to say that our medical staff is really dedicated to help and to assist, and thank them for that. That being from the first day of the war, they provide services to the people. The second one, good relations between clients and doctors before the war, it's continued to keep, and even we have patients who are abroad and still continue to get consultations from the doctors that provide care to them in Ukraine, in parallel that they get assistance in hosted countries. The second one, we conducted supervision groups for healthcare professionals. It's online, offline supervision groups. It's once per month or once per week, depends on the request, to assist them from burnouts, because it's really challenging to be active 24/7.
For sure.
Thank you very much. There have been a number of questions. I think we talked about it in the morning, about the balance between prevention and cure. And it's difficult in peacetime to keep this balance. It's all skewed towards cure. But especially in situations of war, I think it's quite difficult to focus on prevention, because the reaction is, you need to be reactive, basically. But I think this question about prevention is also about Poland. It's about vaccination. How do you communicate about the need to vaccinate, and how do you try to increase the vaccination coverage in a situation where we have refugees whose first priority is probably not getting vaccinated, but they have many other issues? How do you do that?
I agree that this is actually not the first issue when migrants came to Poland, but that's why we decided that each person who would like to stay for more than 3 months in Poland is under our mandatory, our obligatory vaccination calendar, but this calendar is dedicated to kids. So I already shared with you this information, some details, some numbers, that we are organizing this vaccination at the hospitals. As it is organized for Polish kids. We are organized this vaccination in primary healthcare, and we are sharing this information on the same channels as we do for Polish citizens. So this is really important to share via internet, via hotline, for example, I think that this is quite a good example. We established, as the plenipotentiary of Minister of Health, I established a cooperation with NGOs called Ukrainian House. Those are volunteers who are supporting Ukrainian migrants in Poland. Most of them are Ukrainians, and we signed an agreement with them that they are sharing information about Polish healthcare system with people who they support. So I think that these channels are very, very useful for migrants, but this is the most important part, that for the vaccination, we organize this after 3 months of stay in Poland, or after the declaration that the person would like to stay for a longer time in Poland. Briefly.
Thank you.
Thank you.
Thanks.
I've got another question here which I'm going to ask, which is building on something that Herian Ikink has put in the chat here regarding antimicrobial resistance. And it's really a question for all of you. Obviously, you've got a situation where people are being wounded, and there may be all sorts of difficulties in achieving the right sort of treatment in the battlefield situation. So you have the possibility for AMR to develop there. But then also thinking about the hub at Jasionka, you'll be receiving these patients, and then they will be flown to different hospitals in the EU for treatment. So from both sides, how are you kind of addressing that? And maybe I can ask Ihor and Olga first before switching to Katarzyna.
Yes, thank you so much. I think that most important it's effective civil-military cooperation, because from the military side, the first antibacterial drugs will be used on the front line or self-used by the military person. Antimicrobial resistance, it's a really big problem, because previously in Ukraine we don't use electronic prescription for antibacterial drugs, and only I think 2.5 years we implemented this norm and regulation on the national level, but in the same time our baseline of IMR is really high. So I think the strong cooperation between military and civilian sector. The next one, it's strong regulation for prescription antibacterial drugs. It's really useful, and of course it's marshrutisation or triage of patients from the front line to the civilian hospitals. So I think it's our main point for fight IMR in our country.
Okay, I think that the issue of AMR is a challenging topic for each healthcare system. And I'm really impressed by your organization on your ideas how to prevent of overuse of antibiotics. I have to say that we face this challenge with patients from Ukraine, and we know that this is a quite problematic issue for EU countries who which would like to accept Ukrainian patients with some diseases. In Poland, we tried to do our best. We accept patients who need special antibiotic treatment. Sometimes it took 6 months to first treat the patient with antibiotic, and then after the 6 months we are ready to start the treatment. But we are doing this. I know that this is necessary. Of course, we need to organize some isolation parts of hospitals, but we are doing this, and we will do. Yeah, thank you.
Okay, thank you. Maybe we have time for one more final
sure.
question. Paul Malane asked, what have been the approaches used in Poland to provide housing accommodation for the very large numbers of people? Lack of stable home poses, of course, a problem. Big challenges for the delivery and continuity of healthcare. I remember from my mission that the situation was quite unique because there were no big camps where people would stay for a long time. A lot of the refugees were absorbed actually in people's homes. But Katarzyna, can you elaborate more, maybe?
Actually, I thank you very much for this question, because I didn't show this part of Polish support for Ukrainians in my presentation, and I think that this is quite a unique situation. Because, as you probably know, we didn't create any camp for migrants, for refugees. We didn't create any special place for long stay. What we organized, it was, we started with reception points, which were dedicated to people who crossing the border, to support them in a very short time for the 2 or 3 days of stay. So it was first medical aid. It was there were places to take a breath, to calm down, to think, to organize what we would like to do, what people would like to do as the next steps. Of course, we created some centers of support for a longer stay, 2 or 3 weeks, but most of Ukrainian migrants, most of Ukrainian refugees were accepted in Polish homes. And I think that this is something really beautiful and really unusual, because of course each situation has pros and cons. When we create a special camp, it is very easy to organize public health issues at this camp. You know, you can test patients, you can diagnose them, you can organize vaccination, medical support. If you have those people at many, many homes as a part of a family, it is not so easy to organize this kind of healthcare issues. That's why we decided to offer all medical services, all medical healthcare for Ukrainian patients on the same basis as it is for Polish citizens. And I think that it works. We can see, you've seen the numbers, that it really works. Vaccination, drugs, it works, I think.
Thank you very much. I think we are coming to the end of the session, so let us try to summarize. It's impossible to summarize all this in a very few words, but I think I took a few points. I have a full page of just the key points, but I'll mention a few, and we have to think about it and meditate on it and think how to put it in our preparedness thinking. But I heard about training, the need to train staff. This lesson learned about investment in staff came also from our lessons learned from COVID experience. So this is repeated at a time when actually there is some downsizing going on in some countries in the healthcare staff and public healthcare staff. So we have to keep this message to the decision makers high on the agenda. The need to work in a cross-sectional way. It's not about communicable diseases. We heard about nuclear threats and environmental threats, so we have to think in a cross-sectional way. Different sectors have to react to it. The importance of communication. We've talked a lot about communication today already, and it's even more important when something like this happens. And we talked about telemedicine, digital health, stockpiling of drugs. Decentralization is very important of services. It's easier to react when services are decentralized. I think this is it. And from my side, I would like to also thank you for this. It's so important to hear it from you directly and not reading it somewhere. And I know how difficult, we know how difficult it was for you to come here. You mentioned it, there are no flights. You have to really put a lot of effort to reach Stockholm, and also for Katarzyna in her busy life to come here was not so easy. So I really wanted to say dziękuję bardzo and duże dziękuję.
Дякуємо, що запросили.
It's always a pleasure.
I'd also like just to make a few points just to complement Piotr's there. And I think the thing that overall strikes me is just the huge numbers that are involved, the scale of everything that you're working with in both sides. It's actually quite overwhelming when you think about the logistics and getting your head around all the things that need to be done. I think one of the things from the Polish side which really interested me is the importance of the law in actually using the resources that are coming into your country and allowing them to become part of the solution. So actually facilitating Ukrainians to support Ukrainians, and allowing all of the procedures that would have happened for people who are living in Poland ordinarily also to be applying to the refugees who are coming in. So I think this is something which I think is really critical. Flexibility in the legal situation is really important. I also think you mentioned about the Ukrainians treating Ukrainians in Poland. This goes back to me in my thinking as a social scientist and as a behavioral scientist, somebody who thinks about the importance of actually having a relationship with your healthcare provider. This is also about trust and providing your social context so that you're comfortable with the people who are providing you with the services. So again, I think that's a very important principle. But overall, the very last point, again, it comes from Katarzyna, is be human. We're dealing with people who have suffered unimaginably, who are scared, and who need to have a moment to draw a breath and think about, okay, what's going to happen for the rest of my life now, or at least for the foreseeable future. So we see them as people who need our support. And I think, to me, that's the message that I take away from this. And I really thank you all three very much, Ihor, Olga, Katarzyna, for coming here all the way to Stockholm. And as Piotr says, this difficult journey that you have made. Thank you for coming. Thank you for sharing your inspiration and your humility with us. And it's been a very, very rich and rewarding session. Thank you.
Thank you.
Thank you, guys.